beginning of, other diseases that are in the hospital, everybody will tell you that the best place to keep... When I was first advised of the restructuring that the hospital was going through to balance their budget, I was blindsided by the fact of the outpatient physio. That's not one of the things that I certainly expected. It wasn't part of something recognized by the consultation process, and they made it very, very clear that that wasn't one of the things that I was happy with, because there was no even potential alternative solution to that piece. All right? So, I've met with the hospital in Lynn a number of times to rethink that piece of restructuring. In light of the hospital will receive more money in their best budget this year. I will admit, as of today, the number's not there yet. It'll be somewhere between 0 and 1.5%, but it'll be something. Believe me, it's, that's been a top priority when it comes to this issue, and we are making progress. I will tell you that, but I wish I could tell you more today. But there's not a day that I haven't dealt with that issue. That's why we have long-term care strategies driven by CSACs to provide that kind of service at home where it's possible.
They're broke. They're broke. They're underfunded. They're understaffed.
Okay, so let me ask you. So what other service would you like to have cut? I guess to provide some of the more money in that sector.
Maybe the government.
I don't know. How about that e-health boondoggle for $1 billion?
Yep.
I'm looking for $250,000 for physio. That woman over there wants $150,000 for diabetic clinic.
Yep.
And you guys waste $1 billion on the e-health boondoggle,
yep,
where the woman in charge of it is billing the time she bills.
How about all the money?
You have to stand here as our MPP and defend that kind of activity. Is it an emotional issue? Absolutely, because it's jobs, parents, patients, and it comes down to dollars.
I've never defended the activity of e-health. To start with, that's been an ongoing issue for the last about 10 years. So the $1 billion you're hearing, it's an accumulated issue. But I'm not here to point fingers. All I'm saying, we take
excessive. Still wasteful.
I cannot agree with you more, and we take responsibility for that. I make no bones about it. Those people should be shot.
This government is deliberately trying to close down hospitals like this. And I want to say to Mr. Rinaldi before he goes, other MPPs like Rick Bartolucci in Sudbury have brought back $10.5 million to cover the $12 million deficit. Or what about Jim Crater in Niagara, who brought back 12 of 14 million of the deficit for that hospital? Or Jim Brownell in Cornwall, who brought back 5 of 8 million. And you have to ask yourself, what is Mr. Rinaldi doing for us at Queen's Park? Why isn't he fighting for our hospital? Why is all the focus of this government on trying to cut hospital services, which have increased by 24% since Mr. Rinaldi was first elected, while doctors' billings are up 57% and drug costs for Ontario are up 37%? It isn't the hospital in Coburg here which is making healthcare spending unsustainable. It's the private interests of the doctors and the drug companies that Mr. Rinaldi's government won't take on. But he will cut services. And we have to ask him to get back to Queen's Park and be as active for his communities as other Liberal members have been. They have delivered for their communities. Mr. Rinaldi is not delivering for this community, and I think that's one of the reasons we're here.
We are here for our third rally. Why is that? To once again ask Mr. Lou Rinaldi to be our voice and help us fight our hospital cuts. We have seniors that need our hospital beds. We have diabetics that need our clinics, and we have people in need of our outpatient rehab. When did we remove the word care from health care, people? How is it that people in business suits are allowed to make these decisions? People that only seem to care about bottom lines and balanced budgets. How is it that other hospitals have gotten additional funding and saved their services? Let me tell you, they had an MPP that fought alongside of their citizens and helped them receive that much-needed funding. So here we are once again asking Mr. Rinaldi to step it up and go after the McGuinty government for more money to pay for our hospital cuts.
As community hospitals, we must all join together and fight this government to protect our hospital and the services within them. Northumberland is losing 36 beds, closing the diabetic clinic, which had over 3,000 visits last year, and their rehab clinic, which had over 5,000 visits last year. Where will these patients go? To Peterborough, where 71 beds are now being cut? Where will these patients go? On Tuesday, May 11th, Peterborough had a rally at their MPP's office, Jeff Leal, and they let him know the pressure the community wants to install on him for the cuts. Today, May 13th, we stand in Coburn to let Lou Rinaldi know that the pressure is now on him. Stop these hospital cuts.